Thank you, Romeo, for such a wonderful introduction. Very informative. I hope everybody learned some new facts. So, today I will be going in my segment over the cures and treatments of herbal medicine. So, as you can see, I have broken it up into different diseases and disorders that you can use herbal medicine and specific herbs for the treatment of these specific diseases and disorders. So, we're going to start off with the cardiovascular system and diseases of that system. So a very prevalent problem in America, especially with our very high obesity rate, is high blood pressure, also known as hypertension. So there are some specific herbs that you can use in lowering your blood pressure. Some examples are garlic, ginger, cardamom, and cardamom actually is specific, or sorry, special because it also has the ability to lower your risk of blood clots. And this is significant if you are at a higher risk of, developing blood clots. And yeah, so it's a two-in-one package. There's also another two-in-one package in the herbs that help with lowering your cholesterol levels. So we're going to move down to high cholesterol. So people do use cinnamon and curcumin to lower there's good and there's bad cholesterol. So it's important to differentiate that. So this is for lowering your bad cholesterol levels. And so cinnamon also has the two in a package trait, and so it also does lower your blood sugar, which is important. And so we're going to move over to mental health disorders. So there's depression, and this is actually a big one. So people who do have depression, there has been studies that show that using St. John's wort is effective in treating depression. So speak to your doctor and see if that's something that you guys can, work towards incorporating into your lifestyle. And then there's also anxiety. So some herbs are passion flower, chamomile, and valerian. I've heard of chamomile tea. I know that it does help calm me down, so you can always use that. Just take a cup of chamomile tea, drink it at the end of your day, relax. But also, it's important, these do have, some good effects, but it is important to talk to your doctor to make sure that it is, safe for you. Everybody's different, so just, have that chat. Okay, so let's see. So we're going to go into women's health. So there are some herbs that help with women's health, with menstrual pain, some other problems that do affect women and the reproductive system. So there's black cohosh, there's evening primrose, there's feverfew. So if you do have, really strong menstrual pain and cramps and stuff, so talk to your doctor and see if that's something that will help you and be beneficial for you. There's the immune system, there's echinacea, there's golden seal, and there's elderberry that can help with boosting your immunity, especially now that we're in a pandemic that cannot be hurtful to you. So also speak to your physician and see if that's something that's a right fit for you. And then there's also brain health, there's ginkgo, there's biloba, ginseng, and butterbur. These do help with your cognitive performance. So if you're feeling sluggy, look and see if this is something that will be helpful for you. Okay, so just the important thing about herbal medicine is that you want to make sure that you're aware of its limitations. It's important to know that you're not supposed to take it and just stop going to the doctor. It's obviously really important to go get your annual checkups, go speak to your doctor if you feel as if there's something wrong with you. Of course, if you're experiencing certain things and you think you should go to the ER, don't take that cup of chamomile tea and drink it and think that'll help. Go to the ER. That's also really important. Beware of advice that hasn't been regulated or fact checked. That's very important. You can put anything on the internet these days. You don't want to ingest something just because, Lover 2409 said, yes, it's okay to take it. Talk to your physician. Talk to somebody who has this experience and has the education, and make sure that it is safe. So herbal medicine is a practice that it's been used for health promotion and treatment, and it's not only for cures. Or the treatment of potentially fatal diseases. So this does go back to if you feel wonky, if you feel off, go to the ER. Make sure that you're taking those necessary precautions to making sure that you are healthy and safe. So make sure that you talk to your doctor, your physician, your healthcare provider, nurse practitioner, whoever, and make sure that it's safe for you. Like I said, everybody's different, everybody's body's different, everybody has a different reaction to different things. Make sure that it's safe for you. Make sure that it won't interact with other drugs that you've been prescribed. If you go to the doctor, they ask you what other, medications have you been prescribed? What else are you taking? And this is important to know that there may not, or they may be interactions with, these herbs and these drugs. So definitely bring that up to your doctor if you are starting a new herbal supplement, especially. Um, And then you should check the efficacy and what amount has been deemed safe. You don't want to, ingest too much and then have these terrible side effects. So that's also important when you are starting to get into herbal medicine. Okay, so herbs have been used for health promotion since the beginning of time, since there's actually been like studies and evidence that this has been a practice that can go back to the ancient times. So it's still widely used across the world. Actually, there has been a study that shows that around 80% of the world's population does use herbal medicine, which is fascinating. Herbal medicine and herbs do play a large role in commercial medications that are out today. And herbal medicine does have its pros and cons, just like anything else. But it's really important that you make sure that it's beneficial for you, it's safe for you. So have these necessary conversations with your physicians, and just make sure that it's the right fit for you. So thank you so much for coming to Romy and I segment. I hope you learned so much. If you think that this is right for you, of course, talk to your physician, talk to your nurse practitioner, your healthcare provider, whoever you see, and just, try it out. Thank you so much. Have a great rest of your day.